Okay. Hello, everybody. Welcome to another episode of exams related to Royal College of Surgeons. And today I have with me Dr. Dharshini Prithviraj, an old friend of mine. And Dharshini, can you give a short intro about yourself?
Yeah, sure. So first of all, hi, Vinay. Thanks for having me on this. So my name is Dharshini. I'm an orthodontist. I did my undergrad in Meenakshi Dental College, Chennai, and I graduated in 2015. And then after that, I came back to Malaysia and I worked for 2 years and then applied for my master's in orthodontics at UCL, London. So I left for that in 2018 and then graduated in September 2021. So now I'm back in Malaysia and I'm practicing as an orthodontist in a private practice.
Oh, that's nice. Amazing. Just one question which is slightly deviated from our topic. For someone to become a postgraduate in Malaysia, someone who was not a resident of Malaysia, is there an opportunity? Is there an opportunity to do that? Or you need to work for the government, the usual protocols?
Sorry?
You need to work for the government, right? Even the Malaysian citizen needs to work for the government. So somebody is coming from an Indian background or a foreign background. Are they allowed to do a master's there? I just want to know.
To be honest, I'm not entirely sure. I don't personally know anyone who's done that.
Okay.
But I did hear about potential exams that you may have to take before you can, apply to work here or do a postgraduate program and then work, whichever the order. So you might want to double check that. Yeah, I'm not too sure.
Okay.
Sorry.
Okay, no problem at all. So moving on to our topic. So as you mentioned, you have finished your M Orth from the Royal College of Surgeons, Edinburgh. Have I pronounced it correctly?
Yeah, that's right.
Okay. So my first question would be, why did you want to do an M Orth?
Well, to be honest, I didn't know much about the M Orth when I was doing my BDS. Even when I started my master's application process, I didn't know too much about it, but then obviously heard a lot of good things and, the importance and the value it holds from, my dad, who's an orthodontist, and a few other specialists that I've worked with. So the master's program that I applied to had this option where at the end of my 3-year program, I could score the M Orth.
You can proceed.
So yeah. So at the end of the 3-year program, I could sit for the M Orth exams, and they sort of train you for it. So it seemed very ideal. The setup was there, so you just had to put in the work. Otherwise it can be a little overwhelming because you don't know what the application process is like. It's like when you're applying individually for the diploma. So yeah, and also I think it holds a lot of benefits. Number one, you're being affiliated with the Royal College, which is a very prestigious institution. There's automatically a lot of value to the degree. Absolutely. So I'm sure it'll open a lot of job opportunities, whether it's teaching jobs or consulting or just private practice. So it is beneficial that way. And I think it's good practice as well. You learn so much when you prep for the M Orth. It trains you to comprehensively think about all of your cases, time management, communication, so many things, which you can use on a day-to-day practice. So, yeah.
So basically your approach towards the patient or even the subject changes a lot, right? The perspective towards the orthodontist.
Exactly. Yeah, I would say that.
Okay. So you need to be an orthodontist to even write the exam M Orth, right? Or you need to have at least been trained or worked under the department of orthodontics for 3 years, right? Okay.
3 years, yeah.
That would be the requirement or eligibility criteria to write M Orth. Okay.
Yes.
So what were the preparation time which you would ideally suggest for anyone?
So in terms of the knowledge aspect, I feel like that's something you'd be working on throughout your master's program itself. So as long as you're in touch with your theory and all your basic concepts, that shouldn't be too hard, just, maybe 3 to 6 months before your first paper, just start brushing up on all the main topics. But for the part 2, which is your vivas, that one I think requires a lot more work, a lot more time, because you need to get your cases ready. You need to do the write-ups. You need to get them double checked, make sure there are no errors. So I would say when you are in your second year of master's itself, start looking at all cases as potential M Orth cases and start making note of them. Follow up on these cases regularly. Don't lose those patients. Collect records, very, very important, like photos, x-rays, photos of every key stages of treatment, any different mechanics you've done. Just compile them, put them in folders. It just makes life so much easier when you need to start doing the write-ups. So yes, I'd say the prep work probably start when you're in your second year itself, but the studying bit, I think 3 months before the exam should be fine.
Okay, that's fair enough. I could see you mention about the cases, right? So what types of cases you need to present, and how long should the following be up, and you should have treated the patient, right? Then what sort of records you should produce and submit to the authorities?
Okay, so the cases, it can be any case, that has a number of things to talk about. So you don't want it to be too simple, because otherwise you're not going to have much to discuss during the viva. And at the same time, you don't want to take a case where things have gone majorly wrong, because that's not going to look good on the candidate. So I'd say pick your cases wisely, cases where you have, some essential features, where you've done certain types of, mechanics, and, been able to produce good results. Oral hygiene, very, very important. So patients who are compliant, with sort of orthodontic care, things like that, you should be certain of. And then in terms of what records you need, you are given a template. You'll find that on the Royal College website.
Okay.
So it's mostly photographs, all relevant x-rays. OPG and a lateral calf is a must. Although if you're taking lateral calves, you need to be able to justify why you've taken them. And then IOPAs if needed for that particular case. So all that is very, very important.
Okay.
And the rest is just your usual write-up, your diagnosis, your key features, problem list, and all that, treatment plan. Yeah, just follow the template.
Okay. So you have done your UG from India, Masters from Malaysia, and you have written the Royal College of Surgeons and exam. There should be a slight shift in the syllabus. I won't need to say, the concepts are going to remain the same as it is. They're not going to be much of a difference. But as far as the books are concerned, or the way they have certain protocols or guidelines, right, with respect to Edinburgh. So did you have to adapt to something like those, or is there any particular guidelines for them?
Yeah, so I did my master's in the UK.
Oh, in the UK. Okay.
Yeah, I didn't do it in Malaysia. Okay. So I did my master's in London, and then right after that, did the M Orth at the end of my master's. So the guidelines were all the same, because that's what they follow all over in the UK. And all these information are there on the websites. They have advice sheets with the guidelines and the protocol that they follow. So if you have not trained in the UK, then I'd advise you to, get all of this from the official website, and then prep accordingly, because that's the system they will follow during the examination.
Absolutely. Yeah.
But because I trained that, I sort of, got used to it from the beginning of my...
Right? It should have been relatively easy.
Yeah, exactly. Yeah.
So apart from the viva and case presentations, do you have a theory exam? Like, what is the exam format? And you have 1 or 2 days to go for the exam?
Yeah, so you have a part 1 and a part 2. The part 1 is your written paper, and it's single best answers. So it's a 4-hour paper that's, split 2 hours, and then you get like a half an hour break, and then you do the other 2 hours. And then once you clear that, you sit for the second part, and the second part is mostly your vivas, and you also have communication stations at the end. So the format used to be a bit different before COVID. They also did like a knowledge-based Viva. They had OSCEs, but now because of COVID, they had to switch to, online examinations. So the format changed. So I, advise you check before you apply for the exam, because I'm sure they'll change it again. Yeah.
Okay, that's nice. So what would be the cost of the exam? And you have a convocation fee also?
Yeah, so the part one was, I think, about £250. So I think if you convert it to rupees, I think it's each pound is like times 100, if I'm not mistaken. And the part two was £1,500. And then for the convocation, there's no convocation fee as such. But if you are taking guests with you, then you need to purchase guest tickets. So that's around £20, I think, per guest.
Okay.
Nothing for the candidate, though. Yeah.
Okay. So,
and then
proceed. No problem.
No, I was just going to say there are like separate, photography packages and all that. So you can choose to buy that if you want, but it's completely optional. Yeah.
For people who are watching out there, I saw her convocation pictures. They look really good. And unfortunately, for some exams for the past 2 years, this has been a virtual convocation. I think she was quite lucky to have a convocation in person. So if you get the opportunity, do not miss it. It's quite prestigious and a wonderful thing to attend to. Right?
I agree. It's a whole different feeling doing it in person. Yeah.
That's good. So part one and part two, right? So you get your results separately for each, or how does that work? For example, there are certain exams where you can clear part one. Suppose you don't get to part two, you can get another attempt at part two. Does it work similarly here?
Yeah. So you can, at the end of, I think, 2 or 2.5 years of your master's, you can already apply to sit for the part one.
Okay.
And so that happens like, let's say sometime in November.
Okay.
And then the part two will be like the following year, maybe around May.
Okay.
So you have time. Let's say you don't clear your first attempt of the part one. There will be another part one that'll be conducted maybe just a week before the part two in May. So you can, you can choose to sit that as your second attempt and then sit for the part two. Okay. So you'll have a couple chances before you can take the part two exam. Okay. But the schedule keeps changing. So you need to double check. But yeah, there are more than one, couple attempts for sure.
So that's it from my side. Is there anything else you want to add on to the people who are watching?
No, nothing really. I mean, I think the M Orth, if people decide to do it, I think it's great, and it's nothing to be, too afraid of. Like it's definitely something you can crack as long as you put in the work and the time and the energy. And like I said, just start the prep work early enough so you're not, stressed out last minute. But really nothing to be afraid of. Yeah.
Okay. Thank you so much, Dharshini. It was a real pleasure having you with us. And
no,
is it okay
so
if
much.
you share your email ID at the end of this video so that if people have any doubts, they can reach out to you?
Yeah, no, that's absolutely fine.
Okay.
Yeah.
Thank you so much once again. And
no problem.
Thanks a lot. Good luck for all your future plans and whatever you want to do.
Thank you, Vinay. Good luck to you too.
Yeah. Bye-bye.
I'll just take care. Bye.
Bye.